Hi everyone, I want to thank you for joining me for another show of Life Goes On. This is a show brought to you by Elder Circle, a CSEP grantee, which is a Senior Community Service Employment Program, helping those 55 and older find meaningful work and training opportunities. Today I have with me as my guest, Robin Gunnarsson. Hi.
Hi, Carrie.
Thank you for coming.
Thanks for having me.
Yeah, it was kind of short notice, but we winged it. I'm glad. So today's topic is about caregiving. So if you want to just introduce yourself a little bit for the audiences so they can see what kind of a background and where you're coming from.
Okay, thanks. So my background by trade is occupational therapy, and so that's given me a lot of experience in caregiving in a professional role. So I've worked in nursing home settings, a variety throughout Grand Rapids and throughout Superior too. And then personally, I had experience in caring for my father-in-law who had Parkinson's and the Lewy body dementia type, and my grandmother who had the Alzheimer's dementia. And so those two matches already, as well as my experience in caregiving professionally, made a nice fit for doing the caregiver support groups that we have at Elder Circle for the memory loss caregiver, as well as Parkinson's support groups. So. Yeah.
Okay, so you're not, you've been with Elder Circle for about a year now, because you came on the same time I did when I started with Elder Circle.
Yep.
But you don't just do Elder Circle. What else do you do?
Correct. I work with Lutheran Social Services, home office that I have from my home, and I work with the volunteers and supervise them in the foster grandparent program, which is helping seniors work with kids in the schools with their reading and math skills and social skills. And then I work with the senior companion program, helping seniors get other seniors out of their homes or assisted living so that they can reintegrate into the community and have some socialization too. So.
How long have you been with the social services?
For over 4 years.
4 years?
Yeah.
Okay, that's quite a while.
So it's throughout Itasca County and Coochin counties that I have volunteers throughout those two counties.
How many volunteers do you have, do you know?
Nearing 45.
That's still quite a good group.
So, and we started with less than 20 4 years ago. So it's been a really neat growth, and every school in Itasca County has volunteers in them, and we're working on the Invest Early Head Start and starting to fill some of those opportunities too. So
that's a really good program and it kind of fits with what we're going to talk about, the companion piece does, at least, with today's topic of being a caregiver. So I know a little bit about caregiving myself. I am certified, though I don't have your experience, and I definitely cannot, I'd have to have fun trying to switch places interviewing myself, so you're here today for me instead. Okay. But one of the reasons why I wanted to bring this up is just working with CSEP. I do have participants that are caregivers. My dad, who's in his early 60s, my grandpa did just pass away a few weeks back, but he was the primary caregiver for my grandpa as well, and just seeing the stress that he was under. We live in Minnesota with really cold winters, and he doesn't have any firewood in his shed because he was so busy caregiving for my grandpa.
Sure.
So bringing you on to the topic of caregiving, if you want to give kind of an introduction of what caregiving is, and then go into maybe we can start talking about some of resources that can help those that are caregivers, especially those who are working or trying to find jobs, because it's really hard to be able to balance that lifestyle for sure.
So we have a lot of the sandwich generation, as we call it. They're, and even in myself, have parents who are not very healthy all the time, and so I'm taking care of my children, taking care of my parents, could even be taking care of grandparents yet, or we have those in that 55, 60 range too who have parents that are still living because we are living many years past that we ever expected. And now we're being exposed to a lot more of the diseases or just different things that are going on with our bodies too, and so needing more care. And of course, with the cost of living, needing and wanting to stay in our homes longer and as long as we can. So that puts some of that care back on to our family or friends or family, which is the senior companion, or with other programs through Elder Circle too, that with respite that we're helping keep and enable those people to stay in their homes, which is less cost to them and to society, to remain functioning and healthy in their homes, getting firewood if they need, or helping with heating costs, or helping with transportation is a huge issue in our counties too, with the rural areas that we have. So the services that are available are so invaluable for that person to get to the doctor, to get their groceries, to get what kinds of things they are just needing to function day to day, and then providing socialization that is so important to our well-being as well. So those are a lot of different highlights that we hit on. Caregiving, and we'd taken the caregiver coaching class
Right.
together, and so much of it is sometimes by default. You're the family member, you're the spouse, you take care of me. It's not something that always comes naturally to everyone, and there are some that are natural caregivers to begin with, and so it comes easily for them, but it doesn't mean that it comes without stress. There is a lot of stress that comes in caregiving, mentally, physically. You're always wondering how they're doing, how things are going. You're also looking at balancing your schedule and your life and work, and how do you balance all those together. And so that's where a caregiver coach or the support groups really come into play, so that you can get some time for yourself. And that's what we find a lot, is people either burn out or have what I've called compassion fatigue. And so you're giving and giving and giving, and what are you getting in return? Or what are you doing to help yourself and take care of yourself? So many times, and quite often, the statistic is more than half of those who are caregivers may die or become more disabled
Than the ones they're caregiving
than
for.
the ones they're receiving the care. So it's so important and vital to be taking care of yourself just as much, because then you have more to give. So, but when you keep depleting, that cup runs empty and you don't have anything left to give. So
Yeah. So before the show, we were kind of talking about a few different things, and you had mentioned some key topics. If you want to kind of go through some of those keys that you were talking about that are so vital to being able to have a caregiver stay healthy, what would be the number one of those?
the first one, and this is, I'm getting 10 steps, they said, for taking care of a caregiver. And it was focused from a Parkinson's support group. A gentleman had developed this program, and he says these are the 10 things that you need to do. And I think this is a key for anyone. It doesn't matter what the ailment is or the disease process. But the first one he says is find a support group. And that's either for the person who has the disease and that they can attend a support group for them specifically, and or the caregiver needs to help find a support. Now, it doesn't have to be a formal group. It can be a social group that you have, or family members that are supporting you. But sometimes family members are scattered throughout the country, or we don't get along with our siblings as well as we should, or there's division. And so it is so vital to have support, and having someone that can help you, or just listen to you, or listen to the frustrations, or listen to the successes, but to help take care of you as the caregiver.
Okay, so just thinking on that as you're talking about that part about support, and you said that it doesn't have to be formal. So you actually do lead a formal support group, correct?
Correct.
Okay, so not every county is going to have one of those, or within a decent driving range for a lot of those people.
Right,
So
right.
to be able to find a professional support group, what would be the best resource to be able to look those up to see? I know us in Elder Circle with Itasca County has them, but what other ways would someone find a support group?
Sure, good question. So they could look through some of the home care agencies, sometimes have them in their area, or looking on a professional online, say like a Parkinson's disease foundation type, or Alzheimer's Association. Those kinds of websites will list where the support groups are held and who is leading them and where they're at. Sometimes you can even begin your own support group. So if you, just volunteers can run support groups. It's a place that is safe, confidentiality is held, and it's a place where you can support each other. Just to listen, maybe you're learning something new, maybe there's some opportunities for, sometimes within our support groups I have professionals, people that are in that field come and talk about a certain topic. And so it's just a place to learn more, be supported, help each other, and grow and learn from each other too.
Okay.
So.
And the other thing you mentioned was a non, formal support groups. So my thought came to mind, for those that are very active or have a very supportive church, maybe just coming up to a few close people and just asking them, hey, this is what's going on in my life. Yeah. Somebody to be accountable for. So somebody in your work would be one. Maybe you have a shopping date with your girlfriends or something every so often. And so those are the other ideas for non-formal support groups that I was coming across my mind as you're talking about this.
Perfect examples, yeah. So wherever you feel comfortable, because that's the foremost thing, is you have to be able to just have a place that you can just kind of let your hair down and be who you are and say it like it is.
Yeah.
So, yeah.
Okay, so what other ones do you have for?
Another step is to make sure that you are going to the doctor visits with your care receiver, the person who's needing care. Sometimes it's that extra set of ears. Sometimes you're seeing things that they're not going to mention or say, or nor do they really realize. Maybe you're seeing a reaction to medication, or they haven't been drinking as much, or there's just so many different things that could come up based on the disease process and what that person's going through. So you want to definitely try to have that open communication with the physician, know if there's some new medications that are coming down the pike with this person, or changes, or that you've reached a plateau and it's just not working anymore. So being that extra voice and being that extra set of ears is just vital. So going to those doctor visits.
Okay, now I have a question as far as that goes. So I know that my grandpa was going in like twice a week at least, sometimes more than that. So my dad was retired before he really got into that. So for him, it wasn't as big of an issue to be able to go in with my grandpa on a regular basis. Right. But for those who are working and can't take that time off of work to be able to go to visits that might be, at least weekly or a couple times a week, what would be some suggestions for them?
It's a great point. And one of the other tips that he said is don't be hesitant to accept help. So if other people are saying, what can I do to help? Accept help. And one of the thoughts, I have done a Powerful Tools for Caregivers class too a couple of times and been trained in doing that. And one of the steps that I learned in there was make a list of things that you need help with. So maybe it's just watering the plants, or maybe it's taking the dog out for a walk once a week, or going shopping, grocery shopping. Make a list of things that you could use help with. And so when people come to you and say, is there anything I can do to help? You can just point them to that list and say, here's our list of things we need help with. So you aren't specifically asking, because sometimes it is hard for us to ask for help, is huge. And so that you can just say, here's a list of things that we need to have help with. Put a check by it if you want to do it, put initial, or let me know what you're wanting to help with. Those people that are working and are unable to go to appointments, sometimes employments, agencies or positions of work do allow you to go and take some time off for caregiving and for appointments like that. If they don't, sometimes you can schedule them so that it does work, or once again, ask for help, either through family or church members or community members. There are so many different people that are willing just to take people for drives and get them to the doctor appointments. And then ask them, here's a list of things that I would like you to ask the doctor. Please go to the appointment with that person and know more about what is available or what these medications mean. I need to know specifically, or will these drugs interact, or this is something I'm seeing about mom or dad or whoever you're taking care of, or my spouse, and please address these issues. So the other thing too is you can always arrange appointments sometimes with doctors so that you can have just a phone conversation, either ahead of time or afterwards, and just say, these are the things, or an email. They accept a lot of that too.
They do.
A lot of communication.
Yeah. So. Does your companion program, are your companions able to take them?
They can take them to doctor appointments. It's not the primary point of the visit.
But they're able to if needed.
They can, yep. And then they still will go help with pick up their prescriptions or get their groceries or go out for a meal afterwards because it's been a long day. So, but it has to be scheduled within the program and within the volunteer as well as the client's schedule too, because they're seeing other clients and have their own schedules too. So
that's very good. So something I want to just bring up with that part is with companion, because I also help run a companion piece. The companion is for the person being cared for, right? So not for the caregiver. So the caregiver can actually step back and take a little bit of stress off of them, realizing that they're not stepping in to take over. They're not stepping in to, for them, they're stepping in to be a part of a program, so to say, for the person with
a time of respite.
A time of respite. So that way that, you know, that's another thing I was going to say when you were talking about making that list. Some people might make that list and might have people that come and ask to help with things, but they still might feel guilty. I know that's a common effect, is that guilty feeling of, I have to be the one doing it, I'm the caregiver, I have to make sure everything gets done with the parent or the child or myself. So do you have any advice on maybe how to just let go of that guilty aspect of things?
I guess the bottom line comes down to is if you want to give the best care to the care receiver that you're giving care to, you have to take care of yourself. There's only so much in a cup that you can have as reserve, and once that's empty, it's gone, and your care will start going downhill, and you will not be caring for yourself, you'll not be caring for others. And I speak to myself over and again many times of, I want to take care of my family, I want to take care of all the things in my job and everything that has to be taken care of, and I come last. And that's quite often what happens with those who are natural caregivers. Sometimes we just want to give of ourselves and take care of everyone else, save the world kind of feeling, and we can't do it until we let others help take care of us as well as taking care of ourselves. Setting time for exercise and getting that physical exercise. You can do some of these things with that person too, and incorporate and engage them. And so then now that person's getting some kind of exercise, or maybe it's just sitting and moving arms back and forth, and then you throw a joke in there and you laugh and add humor to it, and you're releasing the endorphins so that you're building a lighter mood in the room, or you're also releasing some of those endorphins just by physical engagement and activity. And it doesn't have to be at the Y, it doesn't have to be at an activity center where you're doing a structured activity. It can just be 10 minutes, 5 minutes, come here and there. At commercial break, if you're watching TV and you bat a balloon around, or just raising your arms. And so it can be very, very simple. It does not have to be very strict and regiment and lifting weights and in a program, but it's whatever works best for you, and how you can build that into your day throughout the day is going to be huge benefits compared to just not doing anything at all.
So don't stress, right? Take the time to find a program that works best for you along with the person you're caregiving for. You're going to be able to follow it for a longer length of time and be able to actually still enjoy it.
One of those things in the Powerful Tools for Caregiver class too is we set an action plan. And so we say, by this time next week, I will have done this activity 3 times a week at this time on these days. I mean, be very specific and schedule it into your schedule. Otherwise, it gets pushed to the side. So when you're looking at those things, and then you have accountability when you come back to the class. So find someone that you can be accountable. I'm that way too. If I don't have someone to be accountable to or a membership, then I don't do it. So that's something to think about as well, is just incorporating and building that time into your schedule for you, as well as exercise for you. So however that happens and works best, make it work.
Okay, right. What about another tip? What else?
Well, another one is staying social. And don't let your relationships and friendships and social activities that you enjoy go by the wayside. And I know that would be the first thing and be easiest to do. Maybe this month you can't make it, but make sure you make it next month if it was a certain birthday party of the month, or some kind of activity that you really enjoy, or going to church, or something that you can do together with that care receiver as well, and just bring them along. And then they're getting some social activity. And so trying to look at some simplified ways of doing that. Having someone come to your home if you're not able to get out. So those simple things can happen. It's again planning for it and structuring it and making sure that it does. But to not let those social opportunities go, because we need each other. And you think about long term down the road too, is if this person were to pass away, you still need those friendships and relationships to be there.
Yes,
so you don't want to lose
neglect
them.
And down the road you're free, it can be lost. Exactly.
It can. Yeah.
Those are very, very valuable. So I know that it's an important thing to be able to get out and be able to do stuff. Not just for those that are caregivers by any means, but just those that are just busy in general.
When you're working full time and you have family and friends and all those, there's so many different things that are pulling for attention. But look at the calendar and see when you can schedule it in and make a point of it.
Yeah, and it's definitely important to be listening to yourself and your body as well. So
right,
that's a good point.
Right. It's hard when you're worked and are tired, and to want to feel like going out and doing anything after that too is difficult. But sometimes you just need to schedule it, and once you get going and do it, then it's okay.
Yeah. For those of you who are just joining the program, this is Life Goes On. It is brought to you by Elder Circle, the subgrantee of CSEP, and today I have with me Robin Gunnarsson, and we're talking about caregiving. So moving on, I know we have a couple more topics to cover in the next 10-15 minutes or so. So do you want to cover some of the more of those? I know we had also talked about, and you had mentioned, compassion fatigue. And I know that's a really important thing for people to be understanding. So I don't know if you just want to kind of list briefly some of those other key points for the 10 steps, and then kind of talk a little bit more about that compassion fatigue.
Okay. Yeah. So a couple more of those steps are, and we've kind of talked a little bit about them as well, but knowledge and treatment options. So knowing about what the disease process is this loved one is going through, knowing how the different stages will progress, and kind of being prepared for that is power. And instead of not knowing, and sometimes people prefer to not know and just let things happen. Of course, we only know we have today. We don't have the future all the time either.
Yeah.
So, but just kind of knowing about things and how things will progress, what's expected, what's normal, what's not normal in a disease process, kind of helps plan the course a little bit for you, and not just being an ostrich and putting your head in the sand and not knowing what's going on and what's going to be happening. So that is a wonderful tool. Another tip that they mentioned is respecting that person. That person is still an adult, is an individual, even though they may not be able to talk and engage as they did, to not talk down to that person, to still treat them as an equal, especially if there was dementia that's continuing and progressing and they are limited on how they talk. They still deserve and need respect.
And they still
in
have
support
feelings.
groups, they do. And they mimic your feelings, much like as the disease process goes, much like a child, an infant can smile when we smile. And so to take care of that person and respect them as an individual and as the spouse or parent that they are, within the realm of what they're dealing with at the time too. So that's something else. And I think the last tip is looking at the future, knowing what is available with your Medicare or insurance plans, knowing what is available for long-term care or assisted living or in your area, taking tours and having that person coming along and saying, if this is a road that we need to go down, where would you want to be? What are the options out here? Are we going to have hospice? Are we going to have in-home support? What does our finances look like that we can plan? And what benefits do we have? Is there some disability insurance out there? Those kinds of things. Estate planning is huge. So it puts a lot of more thoughts and things on your plate to think about, but it's so much better to talk and think about them now than 2 or 3 years from now when that person can't talk or think with you and for you and help their wishes come along. Having a living will and a health care directive are so key. Yeah. And just some things that will help take that pressure and stress off of you later. You know where things are going to be taken care of and how. And even if you're in the midst or the end stages of this too, there are still so many options out there that are worth checking into and finding out. And I know Elder Circle has so many invaluable resources. A lot of home care agencies also in through the counties have a variety of resources and places. Senior Linkage Line is another wonderful resource too.
They're huge, yeah.
Definitely there's places to start. Getting support and finding resources to help you take care of your loved one better and helping take care of yourself better. Going back to compassion fatigue is and burnout is wanting to make sure that you are taking care of yourself. Compassion fatigue can come out in many different ways of short-temperedness. You're losing your interests. There's some depression, losing interest in time for things that you once had time for.
Being agitated.
Being agitated, yeah. And like short-tempered.
Very, yes.
Comes quickly and reasonably so. There's a lot going on, even just with work. Realm. You know, if we're still working full-time or part-time and now you're taking care of another loved one, and that is a full-time job. It really is. And giving yourself some leeway and forgiving yourself for those things that have happened in the past. Sometimes there's some tough history that has happened with, if it's a parent or a spouse, and now you're taking care of that person. Can be very challenging. And so even more so, do you need a support group or do you need some support services around to help transition and take care of that loved one? And so wanting to, I just can't emphasize it enough, of taking care of yourself will help give more care and benefits to that person that you're caring for.
So with compassion fatigue, do you know offhand any places or sites, because I know there's tools that a person can pull up to be able to kind of go through this almost little personal quiz to be able to figure out where they're at in all these different categories, and they can kind of be able to tell, are they burning out? Do you know of any of those resources offhand where they can go to be able to find those?
I would probably start even with some of the specific disease process, you know, like if it was Alzheimer's Association or if it's Parkinson's, or those are the two that just come to my mind quicker because I'm entrenched in those right now, but stroke or traumatic brain injury resources. I know a lot of them are online, but I know that a lot of the facilities or agencies in the area too have resources. There's a lot of brochures. So it would kind of be specific for those caregivers that have that disease process that they're working with in the family member, because of the nature of the stress is a little bit variable with each disease that they're going through, especially depending on how high functioning that person is or low functioning. So each of those agencies and organizations would be my starting point, even with cardiac, heart issues or diabetes. Those kinds of things. So those are things that people can really well live with and function fairly high, but you're still taking care of that person. Are they still getting, for someone who is diabetic, are they still getting their meds? Are they still keeping their sugars in check and that kind of thing? We also have alcoholism is huge, and mental health are other areas that are very high on the radar for people, and they can still function quite well in their homes or in the community, but you are still a caregiver for them. You still have that on your mind. How are they doing today? You're always checking in, or you're always, kind of on the radar of how you can do that. So I would check with some of those agencies and see if they have something for a checklist. Definitely for Powerful Tools for Caregivers is a class that can be had, and a lot of resources on that website as well. There's a caregivers, I'm forgetting the actual name, caregivers.com is a site that you can actually go onto and check some resources there too. And so that has some blogs and some open opportunities. Someone who doesn't have internet, I would just say to check into some of those resources and agencies we talked about already, that would be a great resource, because that's where you can actually get conversations with people and start that process. So.
Wonderful. Any other last comments as we get ready to close?
Take care of yourself. There was a story that I heard of a professor who opened up to her class and brought in this glass, and it was half full. And so, of course, the class said, the professor said to the class, is this half full or half empty? Or what's in here? And they said water, and they talked a little bit about it. And some of them said, oh, it's, half full, and some said it was half empty. And she says, really, it doesn't matter about how much is in here. It matters that I'm holding this glass. And if I hold it for a half hour, it's not going to hurt my arm. If I hold it for a couple hours, I'm going to start to feel a kink in it. But if I hold it for several days, I'm going to need some help. I'm going to need to go to the hospital and get my kink removed and, help holding this. I cannot literally hold this glass of water for days and hours and months. And that's the same principle that comes back, is you need help. We need help to relieve that stress. We need help with caregiving for others, even if it's just talking to someone else. However you best take care of yourself, to take care of yourself. You need to let go of that glass, set it down, and then you're ready to pick it back up again and take care of it. So I can't emphasize that more enough, that attend support groups and look into different agencies that are around you that can help and direct you to that. So.
All right, well, thank you for coming, Robin. It was a pleasure to have you on today. Thank you all for watching today. That we were talking about caregiving. As a caregiver, make sure you are checking into yourself physically, mentally, emotionally. It's very important for you to stay healthy to be able to help others as well. The show is brought to you by CSEP, the Senior Community Service Employment Program, helping those 55 and older finding meaningful work employment opportunities. I am currently taking enrollments. However, I don't have any openings until later on this spring, but if you're interested, please give me a call. Thank you and have a good day.